used to, in your womb, when you're moving around during the day, the baby's getting rocked, the baby falls asleep. When you sleep during the pregnancy, baby wakes up, kicks a little bit, as you probably realize towards the end of the end of the third trimester, baby kicks a little bit more frequently at night. That's because they're awake at night when you're trying to sleep, and vice versa. So be patient with the new baby. They are not designed to sleep, and I've had two almost, I could say, terrible sleepers. The second one wasn't as intense as the first. However, they're just not designed to sleep. Just be patient. If some other person's kid is sleeping and yours is not, don't worry about it. They're very rare where you get a sleeping newborn, and they all kind of end up learning to sleep anyway. I found for me the best way is just to let them sleep when they're really tired. I read a few sleeping books and they were pretty bad, like not what I would recommend, but I was a new first time mum, and seeing how different my children are, I feel like books, you just have to take them with general advice. Don't sort of expect your child. I mean, I read one that was very regimented, very strict, and my children did not. Some other people's kids worked well for that kind of regime, but my children did not, and it was probably for our disadvantage that I really tried so hard to stick to a sleep routine, because my kids wouldn't sleep at those times, and it would get me really frustrated and really stressed out. And second time I was like, it didn't work first time. I'm just going to see how the child goes. And we're the kind of family where we might go to bed different times every night. I go out often. I like visiting family often, and sometimes our visits might be, a little bit before or after their scheduled nap. So their nap might be half an hour to an hour difference, and I just dealt with it, and they dealt with it, and it actually worked really well for us, not having to push any like scheduled regime naps. The other thing that I found and read a lot of medical research about is cry it out methods of putting the baby to sleep. So what cry it out is you're trying to teach your baby to self-settle, which is when they teach themselves to sleep. I found the medical research that I read and the pediatricians that I spoke to were really suggesting that it's a very negative effect on the child. So one of my favorite books I read was by Dr. Howard Chilton. He's a pediatrician in Sydney. He's one of the best in his game, and I've read a few other medical research and studies. One is the Dinnerton study. It's over a very long period of time where they studied lots of different ways where environments where children have grown up, and followed them into adulthood. So basically, babies that are subject to extreme stress, for example, when you leave them in the cot to cry by themselves, even for a few minutes, especially before the age of 6 months to 1 year, there's a lot of stress hormones that bubble up in the baby's body. The hormone, particularly called cortisol, was very, very high in babies that were left to cry by themselves in their cot in the hope that they will fall asleep. A lot of these babies eventually did fall asleep and learnt to just fall asleep by themselves, but that's because their stress levels were so high that they ended up just carking it, and that was it for them. They were so stressed out that they fell asleep, and so it looks like it's a successful method. However, it's very harmful, because what happens is that these children who were shown to have levels of stress could potentially have issues with like mood, concentration, trusting the adult. When children can't trust their carers, they don't learn as well. It can actually impact them in their teenage years, where they've actually seen depression amongst babies who have had higher cortisol levels. So it's really not worth it. You might get a baby who sleeps really well. If your baby naturally sleeps fine, great, that's a fantastic bonus. But for me, I felt like if the child was rebellious and didn't want to sleep, and just didn't know how to put themselves to sleep, which is really the main issue, is that the child doesn't know how to self-settle, and that is how a child learns to put themselves to bed. They need cuddles, they need dummy, they need breastfed, they need to be bottle fed, they need to be rocked, shushed, whatever. All these are like things that make them comfortable, remind them of the womb, and they need that so desperately, especially in the first 3 to 6 months. So I suggest definitely from what I've read and speaking to Dr. Howard Chilton. He's written two amazing books. One is My Cherished Baby, and I can't remember the other one, but I'll write it down in the comments when I find it. But just it does explain how you can just really stress out a baby. It looks like the baby's fallen asleep because they are settling, but that's not the case. They're actually just so stressed out that they've given up hope and they've just carked it. They've gone to sleep out of exhaustion. I've heard of some mothers' accounts where babies have vomited out of stress. It's if it goes against your instinct, if you've got a closed door and a baby's crying behind the closed door, I'd say that's your natural God-given instinct that something's not right in there, and you just got to go and cuddle your baby and comfort your baby. Because remember, that 9 months the baby's in the womb, especially the last trimester, so the baby's always warm. The baby can smell, not smell, the baby is aware of you. So when they're first born, they have your smell, they know your smell. They can hear your heartbeat. So that's why when you pat a baby to sleep, it's actually mimicking the mother's heartbeat. Boom, 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 boom. Babies love that whooshing sound. Vacuum cleaners, they might fall asleep when you have a loud noise. On the phone app, you can actually get apps that have like whooshing sounds. That actually is like what the baby hears inside your body, because they can hear blood vessels, and the blood vessels sound like whoosh, whoosh, when you go hear your ultrasound and heartbeat and things like that. It's like a constant whooshing. That's what the baby hears. So when you try to comfort the baby, you're trying to get them to remember what it was like in the womb, because they're now in the big world and they're like, whoa, what's this so different? So really, it's like a dark, dim, a sort of whooshing environment where they could just hear like this heartbeat. They're warm, and that's what we're trying to recreate to comfort the baby. So you can just imagine a baby chucked in the cot, screaming and crying. They need your comfort. So I suggest, if your baby's crying, go get them. If they're happy, leave them. If your baby is happy in the cot and they're don't need much settling, or just maybe a pat, and then that's it, you leave them, that's great. You're blessed. You've got a blessed little baby who's happy to sleep on their own. If your baby doesn't want to sleep on their own, they're still blessed, they're still a blessing, but just go comfort them. Don't leave it, because I think even Dr. Chilton was saying that there's epidemics of kids having high levels of anxiety these days, and I've spoken to a few people who have done PhDs on anxiety in children, primary school age, and apparently it's an epidemic. So if we can sort of make sure these children, it sounds counterintuitive, but I feel like the more love you give a child, the more confident they are. Some people think, even though I've been told as a mother, people are like, oh, leave your child, she needs to, sometimes even my own mum would say, oh, just let her, do her own thing. But if she needs me, I feel like I'm there for her, and she's very confident. What I also think is fantastic, if you can do it, is natural breastfeeding. If you breastfeed the baby for as long as possible. Bottle feeding is wonderful too, but I'd suggest just really cuddle your baby, hold them close when you're bottle feeding. I've seen some people with like a bottle propped up for the baby. If you can, just cuddle them, because if that baby was a breastfed baby, you'd be holding them. So I think holding the baby is amazing. It does produce that bond between the mum and the baby. But also it just helps calm down the baby as well, and soothe the baby when you're holding them. When you do breastfeed, the longer you do it, the more benefits there are. So when I first had my first child, I aimed for 3 months. 3 months was great. Aimed for 6 months. 6 months, kept going up to a year and beyond a year. And the more I've read about the medical research of benefits, decrease in all sorts of diseases, boost in the immunity. Did you know that even when you have gastro or a cold or a flu, the baby can't get all those bugs? They actually get immunity against that, because your milk forms what's called antibodies. So it's like a natural immune defense for the baby. So the baby is getting this immunity, which is amazing. It also decreases breast cancer in women. So if you can do breastfeeding for the baby, great. If you can't, that's okay. But aim at least to give the baby colostrum, which is the first couple of days worth of feeds in the hospital. They help you extract it via sometimes a syringe and things like that. And the colostrum is like a very good immune boost for a newborn baby. And that's just pure immunity, because when a newborn baby comes out into the world, they have no immune system defenses. Their body has to start learning, so they really depend on the mother's immunity quite a lot. What I would suggest is, if you are interested in attachment parenting, have a look at it. I was doing it without even knowing what it was, but literally all I did was just follow my natural instincts. I always held my baby, fed as often as they needed. It's called on-demand feeding, so you don't have a regimen. I'm really against any regimented things for babies if they sway either way, because at the end of the day, like, I eat at different times during the day. Every day is a little bit different, but that's our family. Your family might be more regimented, which is fine if that works for you and the baby. But what I'm against is putting the baby under any undue stress. Now, keep in mind that, having so many sleepless nights is really tough on the mother, especially if you are breastfeeding, because breastfed babies do wake up more frequently at night. Get help, sleep when the baby's asleep. That's what I did. It really helped me. I loved sleeping when the baby was asleep. I just cuddled her and, we had a nice nap. But just keep in mind that, there's probably other people there that are hoping to help you. I had so many people who offered to help me, and even though I said, no, in hindsight, there's always help around. So use it if you've got it, and if you don't have it, it's okay. Just try to do what you can as best for you and the baby, and always make sure that you don't put the baby into any undue stress, and give yourself time. I find with feeding, bottle feeding or breastfeeding with the baby, I do have a lot of patients who had neck and shoulder pain. And so what I suggest is propping a pillow underneath so you can hold the baby, but then there's a lot of problems that come from here and headaches, and so you don't want that on top of having some sleepless nights. So really just putting pillows, a small cushion or whatever, however size cushion you need, and try to feed different. So even if it's bottle feeding, switch arms so that you don't strain one side more than the other, and see how that goes. But if you do have any questions, this is one of my favorite topics, and please don't hesitate to ask. But thank you so much for joining me today, and I hope it's been helpful for you.